The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Marc Ryan, and thanks to everyone for listening in. This week's episode is titled America's Healthcare Spending Crisis, the $9 trillion Question. Can we reform before the system breaks? We'll take our usual 3 breaks, so let's jump right into today's topic. Healthcare reform is one of those issues that seems to return every few years with a new name, a new political debate, and a new set of proposals. But underneath all the politics, all the arguments over insurance coverage, Medicare Advantage, Medicaid, drug prices, and provider payments, there is one fundamental issue that continues to drive everything. The United States healthcare system is becoming increasingly unaffordable, and the latest national health expenditure data from the CMS Office of the Actuary once again confirms what many of us in healthcare already know. The system is growing faster than the economy can sustain it. Healthcare spending continues to consume a larger and larger share of America's economic output. And despite spending more than any other country in the world, we continue to struggle with outcomes, affordability, access, and patient experience. The CMS Office of the Actuary is really the gold standard when it comes to understanding healthcare spending in America. If you want to know where healthcare dollars are going, how much different sectors are spending, who is paying the bills, and where things are headed, this is the source. Each year, the actuary provides historical data and then projections for the next decade. The historical data about a recent calendar year's costs is usually released in December. The projections are usually released in June. And these reports are incredibly important because they show the trajectory of the healthcare system. They tell us whether we are bending the cost curve, and unfortunately, the answer continues to be not enough, or perhaps not at all. Now, before we get into the latest numbers, let's put the issue into perspective. During COVID, healthcare spending as a percentage of GDP surged because of massive government spending, emergency funding, and pandemic-related expenditures. After COVID subsided, that percentage came down slightly, but the long-term trend remains troubling. America continues to move towards spending approximately 1/5 of our entire economy on healthcare. Think about that. 1 out of every $5 generated in the United States economy is projected to go toward healthcare. And the question we have to ask is, are we getting 1/5 of our economy's value in return? Unfortunately, the answer here is also no, and that's increasingly difficult to defend. The United States spends significantly more than other developed countries, depending on the comparison, anywhere from 1/3 to nearly double what many peer nations spend. Yet when we look at international comparisons, we consistently struggle. A recent Commonwealth Fund analysis called Mirror Mirror ranked the United States last among developed nations in overall healthcare performance. That is not because we lack innovation. We have some of the best hospitals, physicians, researchers, and technology companies in the world. The problem is the structure of the system. We've built a healthcare system that rewards volume over value. We pay more for transactions, more procedures, more services, and more intensity. But we have not fully built a system that rewards keeping people healthy, managing chronic disease, preventing complications, in coordinating care. That is the heart of the Healthcare Labyrinth and the recent healthcare reform series we just concluded. We have created a system with incredible capabilities, but without enough alignment between cost and outcomes. So what did the latest data show from the CMS Actuary? Well, the CMS Actuary reported that in 2024, total healthcare spending reached $5.279 trillion. That represented an increase of approximately $353 billion in 1 year, a 7.2% increase. And this was not an isolated event. Healthcare spending also grew at about 7.4% in 2023. So that meant 2 consecutive years of healthcare spending increases above 7%. On a per person basis, America spent $15,474 per person on healthcare in 2024. Well, while final 2025 stats will not be out from the CMS actuary until December of this year, the actuary projects that healthcare spending was about $5.7 trillion in 2025, up 7.3% from, again, about $5.3 trillion in 2024. That was about 18% of GDP. This would be the third straight year of over 7% growth in healthcare in the economy. Those numbers are almost impossible to comprehend. Obviously, not every dollar comes directly from the family checkbook. Some comes through employers, some through taxes, some through premiums, some through government programs. But ultimately, all healthcare spending is paid by someone, and the bill keeps getting bigger. What drove the increase? Interestingly, it was not primary inflation. The actuary found that increased utilization and changes in service intensity were the major drivers. In other words, people used more healthcare services, they received more complex care, and the mix of services changed. The so-called pent-up demand after COVID has lasted longer than many expected, and it does not appear to be subsiding. Patients delayed care during the pandemic, then they came back into the system. We will also continue to see the impact of new technology and new medications, according to the actuary. A perfect example is GLP-1 medications. These drugs have tremendous potential. They may improve health outcomes for millions of Americans over time, but they also represent a major new source of healthcare spending. And this highlights one of the biggest challenges in healthcare reform. Sometimes the very things that improve health can also increase spending in the short term. The question is, how do we pay for innovation while maintaining affordability? That is the healthcare reform challenge. And that brings us to the next question. Where is healthcare spending headed over the next decade? With that, we will take our first break. And when we come back, we will discuss where the CMS actuary says healthcare spending is headed and why the $9 trillion healthcare economy is becoming a reality. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage and a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and we hope you are enjoying this episode. We're covering America's healthcare spending crisis in this week's podcast by talking about a report from the CMS actuary called the National Health Expenditure Data. I promised to cover where healthcare spending is headed next and what the CMS actuary is predicting for the future. And the numbers are eye-opening. Back in June 2025, the CMS actuary projected that healthcare spending would reach approximately $8.585 trillion by 2033. Using 2024 spending as the baseline, that represented growth of more than 60% in less than a decade. Healthcare spending was projected to represent 20.3% of GDP. Now, if you have listened to this podcast before, you know I frequently talk about the 1/5 threshold, the idea that healthcare will consume $1 out of every $5 generated by the American economy. Well, that threshold is not theoretical anymore. We're getting there closer and closer every year. Now, the newest projections move the timeline even further. The CMS actuary now in June of 26 projects healthcare spending will approach $9 trillion by 2034. And healthcare spending is expected to represent 20.6% of GDP. So despite decades of healthcare reform discussions, despite payment reforms, despite technology advances, despite the growth of value-based care models, healthcare continues to expand faster than the economy. Now, there is one important point. The average annual growth rate projected over the next decade is lower than some previous estimates. The actuary projects average healthcare spending growth of about 5.4% annually. That sounds better, but there is a problem. Healthcare spending is still expected to grow faster than income and faster than the overall economy. The actuary projects real per capita healthcare spending growth of approximately 2.8% annually. That is about 0.9 percentage points higher than projected GDP growth. And that difference compounds year after year. A small amount gap becomes a massive affordability problem over time. So what areas are driving future growth? Well, the biggest driver is, as expected, to be prescription drugs. Retail prescription drug spending is projected to grow approximately 5.7% annually from 2025 through 2034. Hospital spending is projected to grow around 5.2% annually. Physician and clinical services, approximately 5.5% annually. And this makes sense. We're entering a period of incredible medical innovation, gene therapies, advanced biologics, GLP-1 medications, precision medicine, artificial intelligence. All of these technologies have tremendous potential. But healthcare has always struggled with one question. How do we encourage innovation while preventing uncontrolled spending? Because innovation without affordability becomes another part of the healthcare affordability crisis. The actuary also noted that administrative costs will continue to rise, and this is another major issue with the healthcare system. The American healthcare system has enormous administrative complexity and duplication. Multiple payers, multiple payment rules, multiple reporting requirements, multiple technology systems. Administrative waste has become embedded in the system. Now, the actuary did acknowledge that future technology improvements could potentially reduce admin burden. But we have heard that promise before. Technology alone will not fix healthcare. The incentives have to change. You cannot digitize your way out of a fundamentally misaligned payment system. A dysfunctional process becomes a faster dysfunctional process when technology is added. So while the future projections are concerning, the bigger issue is what these numbers mean for everyday Americans. And that is what we will discuss next. With that, we will take our second break. And when we come back, we will discuss the impact of rising healthcare costs on insurance coverage, affordability, and access. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and we hope you're enjoying this episode. We are discussing America's healthcare spending crisis and why the latest national health expenditure projections should concern policymakers, employers, insurers, providers, and patients. So far, we have talked about the numbers, But numbers tell a story, and the story is this. Healthcare is becoming increasingly difficult for Americans to afford. The first consequence is coverage instability. The CMS actuary projects the insured rate will decline. Today, approximately 91.8% of Americans have insurance coverage. That is projected to fall. By 2034, the uninsured rate is expected to rise from 8.2% to approximately 9.5%. That may not sound like a huge increase, but millions of Americans losing coverage or becoming underinsured has enormous consequences. And even those with insurance are struggling. A recent West Health Gallup affordability survey highlighted this growing concern. Only about half of Americans are considered financially secure when it comes to healthcare costs. A significant portion of Americans are either cost insecure or cost desperate. This is not just a problem for the uninsured. This is a problem for working families with employer coverage. It is a problem for Medicare beneficiaries. It is a problem for small businesses and their employees, and it is a problem for the overall economy. The second major consequence is higher premiums and reduced choice. The exchange market provides a perfect example. Premiums have increased significantly, and insurers are warning that additional increases are coming. Why? Because healthcare costs are increasing. Utilization is increasing. Drug costs are increasing. And when the underlying healthcare system becomes more expensive, insurance premiums eventually reflect that reality. Insurance companies do not create all healthcare costs, they finance them, and that distinction is often lost in political debates. We also are seeing changes in market participation. Some insurers are leaving certain exchange markets. That reduces competition, and reduced competition can lead to fewer choices for consumers. The third issue is employers. Employers are facing the same affordability challenge that we talked about with the exchanges. Many businesses are responding by moving employees into plans with higher deductibles, higher cost sharing, narrower networks, more consumer responsibility. The result is a hidden shift. Healthcare costs are not disappearing. They are simply moving from employers to employees, from insurers to patients, from premiums to deductibles. The fourth major concern is government programs. Medicare faces enormous long-term challenges. The Medicare trustees continue to warn about the future of the Hospital Insurance Trust Fund. Medicaid faces uncertainty as states deal with rising costs and policy changes. And Medicare Advantage, despite its growth, is also facing financial pressures. Plans are dealing with rising utilization, higher medical costs, and changing payment dynamics. The bottom line, every major segment of healthcare financing is under pressure. Commercial insurance, Medicare, Medicaid, individual markets, no part of the system is immune. And this leads us to the most important question: what do we do about it? Because simply spending more money is not healthcare reform. Coverage expansion without affordability is not healthcare reform. Payment changes without addressing prices are not healthcare reform. We need structural changes, and that is what we'll discuss after one final break. With that, we'll take our last break, and when we come back, we will discuss what true healthcare reform should look like and how we can begin navigating out of the healthcare labyrinth. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back to this edition of the Healthcare Labyrinth Podcast. My name is Marc Ryan, and we hope you're enjoying this episode. Today, we have been discussing the latest national health expenditure projections and the uncomfortable reality that healthcare spending continues to grow faster than our economy can support. So where do we go from here? How do we reform a system this large, this complex, and this entrenched? In my book, The Healthcare Labyrinth, I argue that healthcare reform requires 3 fundamental changes. We just concluded a healthcare reform series on this, but let's reiterate. First, affordable universal coverage. A country as wealthy as the U.S. cannot continue to have millions of people uninsured or underinsured. Coverage matters, but coverage alone is not enough. We have to address affordability. A person with insurance but a $10,000 deductible is not truly protected. Second, a pivot towards care management. The healthcare system must move away from simply treating disease after it happens. We need stronger prevention, better chronic disease management, more coordinated care, more primary care investment, more emphasis on keeping people healthy. The biggest opportunity in healthcare is not another procedure, it is preventing the procedure from being needed. Third, price reform. This is the conversation we still avoid. The United States does not just have a utilization problem, we have a price problem. We pay more for healthcare services than almost anywhere in the world. Hospitals, specialty drugs, physicians, administrative costs, these issues must be addressed. And finally, we have to confront consolidation and vertical integration. Healthcare has become increasingly concentrated. Hospitals buying physician practices, insurers buying providers, pharmacy benefit managers controlling drug channels. These arrangements can create efficiencies, but they can also increase prices and reduce competition. We need to ask a simple question: does every merger, acquisition, and integration actually improve affordability and quality? Or does it simply increase negotiating leverage? Because at the end of the day, healthcare reform must answer one question: how do we spend less while improving health? That is the challenge. The national health expenditure data is not just a collection of statistics. It is a major warning, a warning that without meaningful reform, healthcare will continue consuming more of our economy, more of family budgets, and more of government resources. We cannot afford to ignore this. Healthcare reform is not optional. It is necessary. The only question is whether we make thoughtful reforms now or whether circumstances force even more difficult ones later. That's it for today's episode of the Healthcare Labyrinth Podcast, a reflective add-on to our 5-part healthcare reform series. Thanks for listening. If you enjoyed this episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.